Welcome back to Changing America. Cancer, diabetes, stroke, and heart disease are among the top 5 leading causes of death for African Americans and Latinos alike. All diseases, if detected early, can be treated and controlled, and people can live perfectly happy lives, comfortable ones. But why are Latinos and African Americans in America in alarming numbers dying from diseases that can, for the most part, be managed? Just think about this. Today in the United States, 1 out of every 31 women who dies from breast cancer, and 1 out of 3 die from heart disease. Let's take a listen to something that singer Barbra Streisand said last week during the Women of the World Summit in New York City, addressing this very issue.
But I think women are still viewed as second-class citizens. It's still a kind of old boys club. And whether it's in politics or in the workplace, it's also there in medical research. The mice that they do research on are male mice. Now, how can you do research on male mice about women? They're more complex. They say, oh, they have hormones. Duh.
Similarly, are there enough studies being done on people of color? It is not like one size fits all. According to the CDC, obesity is an issue that is more prevalent in African Americans than Latinos. Another issue, Latinos have one of the highest rates of teenage births. What can we do to tackle some of these health issues when it comes to people of color? To figure it out with me, we've invited Mayra Alvarez, Director of the State Exchange Group for the Obama administration, and Jessica González, the Executive Director of the National Latina Institute of Reproductive Health. Thanks for joining me.
Thank you.
So, I think these are issues oftentimes that we actually tackle in coffee shops, believe it or not, among Latinas, when we say, a lot of the issues that we want to talk about oftentimes are difficult conversations to engage in, whether we're talking about heart disease and diabetes with our parents or whether we're talking about sexual reproductive health with our families. What are the first steps in addressing them? First, among our communities, but then also to officials that can actually help ensure that they're getting the right funding to ensure that they're covering people of color.
Absolutely. I think one of the advantages that we have right now with the constant conversation around the Affordable Care Act is that health is a common topic that you hear on the news, local channels, at the kitchen table, because there's so much buzz around it. And while we could argue that the buzz isn't always positive, what's happening is that we're creating a conversation around the importance of healthcare, the importance of having health insurance, and the importance of using that health insurance and knowing how to use it. And that presents an opportunity for families to talk about what are the right services that they're supposed to be getting, at what point in their lives, what preventive services when they're teenagers or adults. And that is a positive conversation that can lead only to detecting disease early or preventing disease altogether and being able to lead healthier lives.
And I'm actually convinced that once you start talking to the Latino family and saying that preventative care will actually be cheaper in the long run, that all of a sudden does a click and you're like, oh, I could save money?
Absolutely.
Talk about that.
Definitely. I mean, one of the great benefits of the Affordable Care Act is that it removes any cost sharing associated with preventive services, certain recommended preventive services. I think for many Latino families, for many families that are struggling to make their paycheck to paycheck work, when you're talking about a $40 copay to get your mammogram or a $40 copay for an annual checkup that might catch something, they'd rather use that $40 on groceries or on a school field trip. When you take that cost away, that barrier away, you're telling that family they can put their health care first, and that's what the Affordable Care Act is giving Americans every day, the opportunity to get those services, to be more informed healthcare consumers, and hopefully lead healthier lives.
And how has the Affordable Care Act impacted reproductive rights in the Latina community?
The Affordable Care Act has been tremendous in terms of advancing the access to sexual and reproductive health in the Latino community. 1 in 3 Latinos have been uninsured, and that hopefully the Affordable Care Act will change those rates, because Latinos face tremendous barriers to health, to economic security, to education, and one of the barriers that we often face is to reproductive and sexual health. And I love how you mentioned over coffee, right? We have these things called cafecitos where we have conversations with community members around sexual and reproductive health in a comfortable setting, because we know when we're working to dispel stigma, when we're changing the stereotypes around sexual and reproductive health, when we're expanding awareness.
And how do you have those conversations? I'm sure that one of the biggest barriers I know growing up, I grew up in a very Catholic school, household, and my mother basically told her sex talk to me was, you know what's right and you know what's wrong, you better not do what's wrong, right? And that's where it ended. That's not very effective. How do you encourage young women perhaps to broach these subjects with their parents, to have these conversations? Because when we talk about sexual health, Latinas, for the most part, are disproportionately the ones right now in this country impacted because they are the fastest growing group of young women reaching that point. So how do they have those conversations?
It is so critical to have these conversations. The organization that we work for, the National Latina Institute for Reproductive Health, we promote those conversations. We have a campaign called the Yo Soy campaign, and we create toolkits for parents, for families, for communities to use to broach these conversations, to change the stigma and stereotype that exists. Because when those conversations are opened, people are hungry to learn. The information is much needed, because we know when we have access to sexuality education, to birth control, to abortion access, to conversations around being parents, then we're more empowered as a community. We're able to make decisions about our health, our family, and our future, and that's so critical to spurring those conversations and ensuring that we're having really honest ones in our community.
And so how can we get, so right now, Jessica, you're focusing on getting the community more involved in their reproductive health choices. How can we get the government to start looking at NIH, for example, and ensuring that the subjects that they're studying are women and women of color? How can we have more of that two-way street?
Yeah. Well, first and foremost, I think it's important to consider the integrating sexual and reproductive health as part of overall health. We do this with mental health as well. We put it aside and it's something else. It's not part of our bodies. When you make it part of the entire continuum of healthcare services that a family should be talking about, you normalize it. It becomes part of overall health and well-being of our families, of our children, and hopefully that'll make people more comfortable talking about it. When it comes to research, it's critical that we focus on women and people of color. If you look at the demographics of our country and the changing demographics of our country, we need to be responsive to the growing diversity and ensuring that we're taking care of these populations as we move forward for the overall well-being of our country. And thankfully, we have a lot of bipartisan support for NIH and increasing the budget, and I think if we're able to better target those organizations that have the trust of the community, that can better understand what clinical trials are and how to explain them to community and the importance of being involved in clinical trials, be able to translate these complex issues so that people can better understand why it's important to involve themselves.
Are there incentives, for example, for pharmaceutical companies to engage more with communities, diverse communities, in order to participate in clinical trials? Are those programs in existence, or how do people find out about it?
Well, I think you can find out a lot at the NIH website. There's a lot of information regarding clinical trials and the opportunities. Many pharmaceutical companies are seeing the advantages of linking with communities of color. Again, for them, a lot of it's profit. It's being able to expand their market share. But at the same time, you're also looking at where are the growing market share populations. It's people of color. It's
and these are preventable diseases too, right? So when we're talking about diabetes and heart disease, for the most part, they're not genetic. So if there is a concerted effort with organizations and government and business to actually address this in a smart way, we can actually see a lot of these levels fall, because it costs people millions of dollars, the government and the healthcare industry, if these issues aren't addressed. Never mind the nucleus of the family, if all of a sudden the breadwinner is
definitely the majority of our healthcare dollars are spent on diseases, on like heart disease and cancer and obesity related diseases, and the majority of those are preventable if we're able to eat right and exercise and get preventive services. So it's not just a quick and easy solution, but it's an opportunity to think about how many aspects of our daily life really link to our health and our well-being, and being able to take a more active role in those.
And that includes being aware of your body and what you should be doing in order to make sure that
a key component to your overall health is your sexual and reproductive health. And one example of something that's almost entirely preventable but ravages our community is cervical cancer. If someone's able to get their regular screenings, if they're able to access a doctor, if they're able to get care and service in their language, they can, cervical cancer is something that no one should get.
That's right.
And Latinas, unfortunately, have some of the highest rates of cervical cancer in the community. So this is really critical to get the care that you need.
So you guys heard it here first. Well, perhaps not first, because we've been doing this for a while, but seriously, Myra, thank you, and thank you, Jessica.
Thank you.
Please go get screened. Please learn more about NIH on how you can actually be participating in some of these clinical trials. It will help you, but also the